Certified Nursing Assistant Restorative Skills.
Question 1. Before helping a resident to stand who has been lying in bed, the nursing assistant should do what? Option A. Find out what the resident plans to do for the day. Option B. Make sure a walker is available for support. Option C. Ask if the resident has taken any medication recently. Option D. Allow time for the resident to adjust to sitting at the edge of the bed.
The correct answer is option D. Allow time for the resident to adjust to sitting at the edge of the bed. Dangling the legs at the bedside prevents dizziness caused by orthostatic hypotension when moving from lying to standing.
Question 2. A resident on bed rest needs a bedpan but cannot lift their hips. What is the best action? Option A. Ask the nurse if the resident should have a catheter. Option B. Turn the resident onto their side to place the bedpan. Option C. Place an underpad or brief to collect the urine. Option D. Have another assistant help lift the resident.
The correct answer is option B. Turn the resident onto their side to place the bedpan. Rolling the resident is the safest and most comfortable way to place a bedpan for those with limited mobility.
Question 3. True or false? A nursing assistant should never exercise a joint past the point of pain. Option A. True. Option B. False.
The correct answer is option A. True. Passive range of motion should always stop at the first sign of resistance or resident discomfort.
Question 4. True or false? A gait belt should be applied over the resident's clothing. Option A. True. Option B. False.
The correct answer is option A. True. Applying a gait belt over clothing prevents skin irritation and shearing during transfers.
Question 5. True or false? Range of motion exercises help to prevent contractures. Option A. True. Option B. False.
The correct answer is option A. True. Regularly moving joints through their full range keeps muscles and tendons from shortening.
Question 6. True or false? You should always use 2 people when log rolling a resident. Option A. True. Option B. False.
The correct answer is option A. True. 2 people are required to safely maintain the alignment of the resident's spine during the roll.
Question 7. Which healthcare professional focuses on helping a resident restore physical function? Option A. Occupational therapist. Option B. Physical therapist. Option C. Speech-language pathologist. Option D. Social worker.
The correct answer is option B. Physical therapist. Physical therapists specialize in improving mobility, strength, and balance after an injury or illness.
Question 8. How often should residents who are confined to bed be repositioned? Option A. Once every 4 hours. Option B. Every 2 hours. Option C. Once per shift. Option D. Only when they ask to be moved.
The correct answer is option B. Every 2 hours. Frequent repositioning is the primary way to prevent the development of pressure injuries.
Question 9. What is a prosthesis? Option A. A type of hearing aid. Option B. An artificial limb or replacement part for the body. Option C. A special type of wheelchair. Option D. A medical diagnosis.
The correct answer is option B. An artificial limb or replacement part for the body. Prosthetics include items like artificial legs, arms, and glass eyes.
Question 10. What is the definition of rehabilitation? Option A. The process of a resident getting older. Option B. Restoring a disabled person to the highest level of functioning possible. Option C. Providing comfort care only. Option D. Moving a resident to a different facility.
The correct answer is option B. Restoring a disabled person to the highest level of functioning possible. Rehabilitation involves therapies designed to regain lost skills and independence.
Question 11. What is a restorative aid? Option A. A specialized type of walker. Option B. A nursing assistant with special training in restorative nursing and rehab. Option C. A medication that restores memory. Option D. A device used to help a resident breathe.
The correct answer is option B. A nursing assistant with special training in restorative nursing and rehab. Restorative aids assist residents with exercises and functional training.
Question 12. Restorative nursing care is best described as which of the following? Option A. Care that focuses only on the resident's spiritual needs. Option B. Care that helps people regain health, strength, and independence. Option C. Care that is only provided in a hospital. Option D. Care that involves performing surgeries.
The correct answer is option B. Care that helps people regain health, strength, and independence. Restorative nursing maintains the gains made during formal rehabilitation.
Question 13. What is postmortem care? Option A. Care given to a resident right before they die. Option B. Care of the body after death. Option C. The process of reading a person's will. Option D. A type of spiritual counseling.
The correct answer is option B, care of the body after death. Post-mortem care involves cleaning and positioning the body with respect.
Question 14. What does the abbreviation AMB stand for? Option A. Ambulance. Option B. Ambulate or walk. Option C. Ambidextrous. Option D. Ambient temperature.
The correct answer is option B, ambulate or walk. Ambulation is the medical term for walking.
Question 15. If a resident has had a stroke and their left side is weak, which side do you dress first? Option A. The right side. Option B. The left side. Option C. The side with the best circulation. Option D. The side without the hospital band.
The correct answer is option B, the left side. Always dress the weak or affected side first to ensure proper positioning.
Question 16. When is the device called a transfer belt? Option A. When helping a person walk. Option B. When moving a person from one place to another, such as bed to chair. Option C. When the resident is sleeping. Option D. When used as a restraint.
The correct answer is option B, when moving a person from one place to another, such as bed to chair. Transfer belts provide a secure place for the assistant to grip during a move.
Question 17. What could be a serious consequence of a resident laying flat on their back for too long? Option A. Improved circulation. Option B. Pneumonia. Option C. Increased muscle strength. Option D. Better sleep.
The correct answer is option B, pneumonia. Immobility allows fluid to collect in the lungs, increasing the risk of infection.
Question 18. What is orthostatic hypotension? Option A. High blood pressure while lying down. Option B. A drop in blood pressure when the person stands up suddenly. Option C. A rapid heart rate during exercise. Option D. A type of lung infection.
The correct answer is option B, a drop in blood pressure when the person stands up suddenly. Dangling the resident at the bedside helps prevent this condition.
Question 19. In the FAST acronym for strokes, what does the letter S stand for? Option A. Sleeping. Option B. Slurred language or speech. Option C. Sweating. Option D. Sensation.
The correct answer is option B, slurred language or speech. Difficulty speaking or understanding others can indicate a brain injury from a stroke.
Question 20. What is a sepsis? Option A. A serious infection in the blood. Option B. Being free of pathogens. Option C. The growth of bacteria. Option D. A type of medical equipment.
The correct answer is option B, being free of pathogens. Aseptic techniques prevent the transfer of harmful microbes.
Question 21. What does the medical abbreviation AMB stand for? Option A. Ambulance. Option B. Ambulate or walk. Option C. Ambidextrous. Option D. Ambient temperature.
The correct answer is option B, ambulate or walk. Ambulation is the clinical term for walking.
Question 22. What does the abbreviation PT stand for? Option A. Patient time. Option B. Physical therapy. Option C. Post-treatment. Option D. Pulse test.
The correct answer is option B, physical therapy. Physical therapy helps residents improve their physical strength and mobility.
Question 23. What does the abbreviation ROM stand for? Option A. Read-only memory. Option B. Range of motion. Option C. Routine oral meds. Option D. Right of movement.
The correct answer is option B, range of motion. Range of motion exercises keep the resident's joints flexible.
Question 24. What does the abbreviation SNF stand for? Option A. Safety Nursing Facility. Option B. Skilled Nursing Facility. Option C. Standard Nursing Facility. Option D. Staff Nursing Facility.
The correct answer is option B, skilled nursing facility. A skilled nursing facility provides 24-hour nursing and rehabilitation care.
Question 25. If a bed rest resident cannot lift their hips for a bedpan, what should you do? Option A. Turn the resident onto one side to place the pan. Option B. Ask for a catheter. Option C. Place a brief to collect the urine. Option D. Have 3 people lift the resident.
The correct answer is option B, ask for a catheter. Rolling the resident is the safest way to place a bedpan for those with limited mobility.
Question 26. All of these precautions should be followed when using a transfer gait belt except which of the following? Option A. Slightly rocking and pulling when using a gait belt. Option B. Never using a frayed or worn transfer gait belt. Option C. Not worrying about proper body mechanics. Option D. Placing transfer belts around the resident's waist.
The correct answer is option C, Not worrying about proper body mechanics. Proper body mechanics must always be used to protect both the staff and the resident from injury.
Question 27. Which of these is true about cultural awareness in a care facility? Option A. It is ideal but not always practical due to staffing. Option B. Cultural awareness must be a part of staff training for holistic care. Option C. It is sometimes sacrificed when it costs too much to implement. Option D. It is not practical in a large facility.
The correct answer is option B. Cultural awareness must be a part of staff training for holistic care. Providing care for the whole person requires understanding and respecting their cultural background.
Question 28. How is family an important part of cultural awareness? Option A. Spiritual beliefs may affect how much care the family allows. Option B. Cultures may interpret the role of caregivers differently than the care plan. Option C. Different cultures may have different expectations of gender roles. Option D. All of these are correct.
The correct answer is option D. All of these are correct. Understanding family dynamics and cultural expectations is essential for a successful care plan.
Question 29. A resident has suffered a stroke and you are helping with ambulation. Where is the best position? Option A. In back of the resident. Option B. On the resident's unaffected side. Option C. In front of the resident. Option D. On the resident's side that has been affected by the stroke.
The correct answer is option D. On the resident's side that has been affected by the stroke. Standing on the resident's weak side provides the most support and safety in case they stumble.
Question 30. Why should you take a team player approach when you need to ambulate a resident? Option A. You do not have to work as hard with help. Option B. The resident can be ambulated more quickly. Option C. One person explains the move while the other lifts. Option D. The resident will feel and be safer with 2 or more staff.
The correct answer is option D. The resident will feel and be safer with 2 or more staff. Using multiple caregivers for transfers reduces the risk of falls and increases resident confidence.
Question 31. What is a proper precaution for a resident who is unable to move themselves? Option A. The resident should be turned once per shift. Option B. The resident should be routinely checked for pressure sores. Option C. The resident should be turned every 6 hours. Option D. Alignment is not important.
The correct answer is option B. The resident should be routinely checked for pressure sores. Frequent skin checks and repositioning at least every 2 hours are standard for immobile residents.
Question 32. Which of these is not a way to assist a resident to rest more comfortably? Option A. Create a quiet environment. Option B. Offer diversion activities like reading. Option C. Remove all positioning devices so they do not interfere. Option D. Pacing activities to allow for rest.
The correct answer is option C. Remove all positioning devices so they do not interfere. Positioning devices are often necessary to keep a resident comfortable and in alignment during sleep.
Question 33. When caring for a client using a restraint, what should the assistant do? Option A. Assess the client once every hour. Option B. Ensure the device is very tight. Option C. Check the client's body alignment. Option D. Release the device once a shift.
The correct answer is option C. Check the client's body alignment. Monitoring alignment and comfort is critical for residents in restraints.
Question 34. When transferring a client to a different unit, what is the most important information to get? Option A. The phone number to their room. Option B. The medical diagnosis. Option C. The name of the spouse. Option D. The client's name and new room number.
The correct answer is option D. The client's name and new room number. Correct identification and location are essential for a safe transfer.
Question 35. Who helps a resident restore physical function such as walking? Option A. Occupational therapist. Option B. Physical therapist. Option C. Social worker. Option D. Dietitian.
The correct answer is option B. Physical therapist. Physical therapists focus on mobility, strength, and balance.
Question 36. What is the medical term for the wasting away of a muscle? Option A. Hypertrophy. Option B. Atrophy. Option C. Dystrophy. Option D. Anatomy.
The correct answer is option B. Atrophy. Atrophy is common in residents with limited mobility.
Question 37. What is restorative nursing care? Option A. Care that focuses only on end of life. Option B. Care that helps residents regain health and independence. Option C. Care provided only in hospitals. Option D. Care that involves performing surgery.
The correct answer is option B. Care that helps residents regain health and independence. Restorative care maintains the progress made during formal rehabilitation.
Question 38. What should be used to turn off a water faucet after hand washing to prevent recontamination? Option A, your clean hands. Option B, your elbow. Option C, a dry paper towel. Option D, a wet washcloth.
The correct answer is option C, a dry paper towel. Using a dry paper towel prevents germs on the handle from transferring back to your clean hands.
Question 39. What should a nursing assistant do before assisting a resident onto a standing scale? Option A, adjust the resident's clothing. Option B, move the scale weight to 0. Option C, give the resident a snack. Option D, ask the resident to jump.
The correct answer is option B, move the scale weight to 0. Zeroing the scale is necessary to obtain an accurate starting point for the measurement.
Question 40. When should anti-embolism stockings be applied for maximum effectiveness? Option A, while the resident is walking. Option B, directly after a heavy meal. Option C, while the resident is in bed or with feet elevated. Option D, only at night.
The correct answer is option C, while the resident is in bed or with feet elevated. Applying stockings before the legs swell from standing ensures they provide proper compression.
Question 41. How should a nursing assistant move a joint during passive range of motion? Option A, quickly and with force. Option B, past the point of pain to increase flexibility. Option C, gently and avoid fast, jerky movements. Option D, only one time per joint.
The correct answer is option C, gently and avoid fast, jerky movements. Slow, rhythmic movements prevent muscle strain and joint injury.
Question 42. What is the technique for log rolling a resident with hip fracture precautions? Option A, use one person to pull quickly. Option B, roll the resident onto the injured side. Option C, keep the head, spine, and legs aligned in a single movement. Option D, twist the shoulders first.
The correct answer is option C, keep the head, spine, and legs aligned in a single movement. Log rolling maintains perfect spinal and hip alignment to prevent further injury.
Question 43. What does the abbreviation ROM stand for? Option A, read-only memory. Option B, range of motion. Option C, routine oral meds. Option D, right of movement.
The correct answer is option B, range of motion. Range of motion exercises are used to maintain joint flexibility.
Question 44. Who is the healthcare professional that helps restore physical function like walking? Option A, occupational therapist. Option B, physical therapist. Option C, social worker. Option D, speech therapist.
The correct answer is option B, physical therapist. Physical therapists focus on mobility, strength, and gross motor skills.
Question 45. What is a prosthesis? Option A, a type of hearing aid. Option B, an artificial limb or body part used to replace a missing one. Option C, a special type of walker. Option D, a medical diagnosis.
The correct answer is option B, an artificial limb or body part used to replace a missing one. Prosthetics help residents regain independence and function after losing a body part.
Question 46. What is the primary goal of rehabilitation? Option A, to move the resident to a different facility. Option B, to restore a person to the highest level of functioning possible. Option C, to provide only comfort care at the end of life. Option D, to cure a chronic disease.
The correct answer is option B, to restore a person to the highest level of functioning possible. Rehab involves multiple therapies to help residents recover lost skills.
Question 47. What is restorative nursing care? Option A, care provided only in a surgical center. Option B, care that helps a person regain or maintain health and independence. Option C, care that focuses only on medication. Option D, care provided only to children.
The correct answer is option B, care that helps a person regain or maintain health and independence. Restorative care maintains the progress made during formal rehabilitation.
Question 48. True or false, range of motion exercises help prevent contractures? Option A, true. Option B, false.
The correct answer is option A, true. Regular joint movement keeps muscles and tendons from shortening.
Question 49. When caring for a client using a restraint, what should the nurse aide do? Option A, assess the client once every hour. Option B, ensure the protective device is very tight. Option C, check the client's body alignment. Option D, release the device once per shift.
The correct answer is option C, check the client's body alignment. Maintaining proper alignment and monitoring circulation are critical for residents in restraints.
Question 50. When transferring a client to a different unit, what is the most important information to get from the nurse? Option A, the phone number to the client's room. Option B, the client's medical diagnosis. Option C, the name of the client's spouse. Option D, the client's name and new room number.
The correct answer is option D, the client's name and new room number. Correct identification and the specific new location are required for a safe and accurate transfer.
Question 51. A resident who must stay in bed is at risk for developing which condition? Option A, dementia. Option B, arthritis. Option C, foot drop. Option D, Parkinson's disease.
The correct answer is option C, foot drop. Immobility can cause the muscles in the feet to weaken and contract, leading to foot drop.
Question 52. A resident's elbow is stiff and will not bend during range of motion. What should the aide do? Option A, continue exercises but move on to another joint. Option B, continue since stiff joints are a normal part of aging. Option C, apply gentle pressure to try to bend it. Option D, suggest the resident see a physical therapist.
The correct answer is option A, continue exercises but move on to another joint. Never force a joint, skipping the stiff area and reporting the finding is the safe protocol.
Question 53. How much assistance does a resident receiving passive range of motion need? Option A, partial assistance with range of motion exercises. Option B, full assistance with the aide taking the joints through exercises. Option C, minimal assistance to just remind the resident. Option D, minimal assistance to provide support while the resident moves.
The correct answer is option B, full assistance with the aide taking the joints through exercises. Passive range of motion means the staff performs the movement for a resident who cannot.
Question 54. A resident returns from the hospital after a hip replacement. What should the aide expect? Option A, the resident will be dependent and need total care. Option B, the resident will be confined to bed for several weeks. Option C, the resident will go to physical therapy to increase mobility. Option D, the resident will receive range of motion exercises to the hip.
The correct answer is option C, the resident will go to physical therapy to increase mobility. Rehabilitation for hip replacement focuses on early mobility and professional physical therapy.
Question 55. When a person is receiving end-of-life care, the resident's care plan is likely to include which of the following? Option A, ways to best provide for the comfort of the resident. Option B, exercises to help improve the resident's strength. Option C, frequent observation to help prevent confusion. Option D, instructions for providing post-mortem care.
The correct answer is option A, ways to best provide for the comfort of the resident. The focus of end-of-life or palliative care is comfort, dignity, and pain management rather than rehabilitation.
Question 56. A new resident asks for help to go to the bathroom before their care plan is completed. What should you do? Option A, ask the resident to use a walker while assisting them. Option B, get another nursing assistant to help you walk them. Option C, position a commode chair next to the resident. Option D, ask the charge nurse for instructions on what help is needed.
The correct answer is option D, ask the charge nurse for instructions on what help is needed. Safety is the priority. Until the care plan specifies the transfer status, the nurse must provide guidance.
Question 57. While performing range of motion exercises, you notice a resident's elbow is stiff and will not bend. What should you do? Option A, continue exercises but move on to another joint. Option B, continue since stiff joints are a normal part of aging. Option C, apply very gentle pressure to try to bend the elbow slightly. Option D, suggest the resident see a physical therapist for the elbow.
The correct answer is option A, continue exercises but move on to another joint. Never force a joint to move past the point of resistance or pain, skip the joint and report the finding.
Question 58. How much assistance does a resident receiving passive range of motion need from the nursing assistant? Option A, partial assistance with range of motion exercises. Option B, full assistance with the assistant taking joints through exercises. Option C, minimal assistance to just remind them when to exercise. Option D, minimal assistance to provide support while the resident moves.
The correct answer is option B, full assistance with the assistant taking joints through exercises. Passive range of motion means the resident cannot move the joints themselves and requires the assistant to do so.
Question 59. A resident has returned from the hospital after a hip replacement. What should the nursing assistant expect? Option A, the resident will be dependent and need total care. Option B, the resident will be confined to bed for several weeks. Option C, the resident will go to physical therapy to increase mobility. Option D, the resident will receive range of motion exercises to the hip.
The correct answer is option C, the resident will go to physical therapy to increase mobility. Post-surgical care for hip replacements focuses on early mobilization and structured rehabilitation.
Question 60. When walking with a resident using a gait belt, where should the nursing assistant stand? Option A. In front of the resident. Option B. At the resident's side or slightly behind. Option C. 3 feet away from the resident. Option D. Behind the resident with both hands on their shoulders.
The correct answer is option B. At the resident's side or slightly behind. Standing to the side and slightly behind provides the best support if the resident stumbles.
Question 61. When log rolling a resident with hip fracture precautions, you should do what? Option A. Use at least 2 people. Option B. Roll the resident onto the injured side. Option C. Keep the head of the bed at 45 degrees. Option D. Twist the resident's spine slightly.
The correct answer is option A. Use at least 2 people. Log rolling requires multiple staff to keep the resident's head, spine, and legs in perfect alignment.
Question 62. When assisting a client in learning to use a walker, it is important to do what? Option A. Stand behind him and use a transfer belt. Option B. Put padding all the way around the top rim. Option C. Let him walk by himself to gain independence. Option D. Let him practice for the first time on the day of discharge.
The correct answer is option A. Stand behind him and use a transfer belt. A transfer belt allows the assistant to stabilize the resident if they become unsteady while using the walker.
Question 63. When does restorative care begin? Option A. A week after admission. Option B. As soon as possible. Option C. Whenever the patient wants. Option D. Twice a week.
The correct answer is option B. As soon as possible. Rehabilitation and restoration of function should start immediately to prevent further decline.
Question 64. Frequent turning and repositioning of the client helps to prevent which condition? Option A. Dementia. Option B. Arthritis. Option C. Pressure injuries. Option D. Heart disease.
The correct answer is option C. Pressure injuries. Relieving pressure on bony prominences is the primary way to maintain skin integrity.
Question 65. What does the term ambulate with assistance mean? Option A. The client can walk alone. Option B. The client can walk with the nursing assistant providing help. Option C. The client must stay in bed. Option D. The client needs a mechanical lift.
The correct answer is option B. The client can walk with the nursing assistant providing help. Assisted ambulation means the resident needs physical support or supervision from a staff member.
Question 66. How many legs does a quad cane have? Option A. 1. Option B. 2. Option C. 3. Option D. 4.
The correct answer is option D. 4. A quad cane has a 4-point base that provides more stability than a standard cane.
Question 67. Exercises that move each muscle and joint are called what? Option A. Weightlifting. Option B. Range of motion. Option C. Running. Option D. Yoga.
The correct answer is option B. Range of motion. Range of motion exercises help prevent contractures and maintain joint health.
Question 68. What is the process of restoring a disabled client to the highest level of functioning possible? Option A. Retirement. Option B. Rehabilitation. Option C. Recession. Option D. Reduction.
The correct answer is option B. Rehabilitation. Rehabilitation programs involve many different types of therapy to help a resident recover.
Question 69. How many tips does a quad cane base have? Option A. 1. Option B. 2. Option C. 3. Option D. 4.
The correct answer is option D. 4. The 4 tips provide a wider base of support and more stability for the resident.
Question 70. Restating the person's message in your own words to ensure understanding is called what? Option A. Clarifying. Option B. Focusing. Option C. Paraphrasing. Option D. Open-ended questioning.
The correct answer is option C. Paraphrasing. Paraphrasing helps verify that the nursing assistant has interpreted the resident correctly.
Question 71. A prosthesis is defined as which of the following? Option A. A type of medication. Option B. An artificial limb or body part. Option C. A special type of diet. Option D. A medical insurance plan.
The correct answer is option B. An artificial limb or body part. Prosthetics help residents regain function after the loss of a natural body part.
Question 72. The nursing assistant is caring for a patient who is a 2-person transfer assist. She plans on using a Hoyer lift because she is in a hurry. The assistant brings the lift into the room and the resident asks, "Are you going to get someone to help you?" What should the assistant tell the patient? Option A. No, I am in a rush, you will be okay. Option B. Yes, I will get another CNA to help. Your safety comes first. Option C. Explain to the patient that you will be extremely careful. Option D. Tell the patient you will get help but it will take a while.
The correct answer is option B. Yes, I will get another CNA to help. Your safety comes first. Facility safety protocols for mechanical lifts almost always require 2 staff members. The aide must prioritize the patient's safety over their own schedule.
Question 73. The nurse aide is assisting a resident with ambulation. This patient uses a cane for ambulation. How should the nurse aide assist this patient? Option A. Stand on the same side as the cane. Option B. Stand on the patient's weaker side. Option C. Stand behind the patient in case they fall. Option D. Walk backward in front of the patient.
The correct answer is option B. Stand on the patient's weaker side. When assisting with ambulation, the aide should stand on the patient's affected weaker side to provide support and balance.
Question 74. The care plan indicates a client should be repositioned every 2 hours when in bed. What is the reason for this? Option A. Increase client comfort. Option B. Provide the opportunity to check in. Option C. Decrease fall risk. Option D. Prevent skin breakdown.
The correct answer is option D. Prevent skin breakdown. Frequent repositioning is necessary to prevent prolonged pressure, which leads to tissue ischemia and skin breakdown.
Question 75. The patient who is bedbound is at risk for which of the following? Option A. Dysphagia. Option B. Polydipsia. Option C. Atrophy. Option D. Neck paralysis.
The correct answer is option C. Atrophy. Atrophy is the wasting away of muscle tissue due to lack of use, which is a risk for patients with limited mobility.
Question 76. Which should be included when repositioning a patient higher in the bed? Option A. Lower the height of the bed to the lowest position. Option B. Raise the head of the bed. Option C. Lower the head of the bed. Option D. Grasp the client under the arms and pull.
The correct answer is option C. Lower the head of the bed. Lowering the head of the bed to a flat position makes it easier to move the patient upward and reduces physical strain.
Question 77. The CNA is working on a hospital surgical unit. Which of the following post-op clients will require log rolling? Option A. A client recovering from spinal fusion. Option B. A client recovering a kidney transplant. Option C. A client recovering from abdominal surgery. Option D. A client recovering from a knee replacement.
The correct answer is option A. A client recovering from spinal fusion. A client recovering from spinal fusion. Log rolling is a positioning technique that maintains spinal alignment and prevents further injury. The bed is in a flat position. At least 2 healthcare workers are needed to turn the client with one single motion.
Question 78. The CNA is caring for a client who is recovering from major surgery. The client speaks a different language and seems to have many questions. What is the best way for the CNA to communicate with this client? Option A. Contact the hospital's translation service. Option B. Rely on a smartphone translation app. Option C. Ask the client's family to translate. Option D. Use gestures and facial expressions.
The correct answer is option A. Contact the hospital's translation service. Contact the hospital's translation service. This is the best option for legal medical issues. Family members may be helpful for understanding more about the client, but misinterpretation is possible. Smartphones and gestures can also be helpful, but not for legal medical issues.
Question 79. A resident with dementia has difficulty understanding explanations about their care. What is the most appropriate way to communicate with the resident? Option A. Speak slowly and loudly to make sure the client hears. Option B. Use simple words and demonstrate what is happening. Option C. Avoid as much verbal communication as possible to reduce confusion. Option D. Give detailed instructions so the client has more information.
The correct answer is option B. Use simple words and demonstrate what is happening. Use simple words and demonstrate what is happening. When communicating with a client who has dementia, use simple words in short sentences. Demonstrating what is happening or how to do something is also helpful. Avoiding communication is not good client care or respectful. Giving detailed instructions only adds to the client's confusion. Speaking slowly and loudly is not useful or respectful.
Question 80. The purpose of active range of motion exercises is to prevent which of the following? Option A. Loss of joint motion. Option B. Pressure sores. Option C. Migraine headaches. Option D. Poor circulation.
The correct answer is option A. Loss of joint motion. Loss of joint motion. Active range of motion, AROM, maintains and improves joint function. Unlike passive range of motion, AROM requires the client to contract muscles which keeps them strong. It can also help relieve pain by increasing blood flow to the joints.
Question 81. The nursing care plan states, transfer with mechanical lift. However, the client is very agitated. To transfer the client, the nurse aide should: Option A, keep the wheels unlocked so the lift can move with the client. Option B, lift the client without the mechanical device. Option C, place the client in the lift. Option D, get assistance to move the client.
The correct answer is option C. Place the client in the lift. Get assistance to move the client. Client safety is always your highest priority. Do not try to accomplish a task alone if a patient is unable to cooperate for any reason. It is important to follow the nursing care plan, including all the steps for operating any equipment being used to move or transfer the client. Ask a coworker to help if you have any concerns about keeping the client safe. If the client remains agitated, notify the nurse before proceeding.
Question 82. Mrs. Hernandez had a hip replacement and is admitted to the long-term care facility for rehabilitation. Her condition is considered: Option A, chronic. Option B, tonic. Option C, acute. Option D, obstetric.
The correct answer is option C. Acute. Acute. An acute event is a new or sudden situation that is expected to resolve. Examples are a broken bone, head cold or flu, or an asthma attack.
Question 83. The loss of the ability to express oneself is known as: Option A, verbal communication. Option B, aphasia. Option C, speech therapy. Option D, empathy.
The correct answer is option B. Aphasia. Aphasia. When a client has suffered a stroke or some other head injury, the speech center of the brain can be damaged, resulting in aphasia. Chief signs of aphasia include difficulty finding appropriate words when speaking, trouble understanding speech, and difficulty with reading and writing.
Question 84. When lifting, the nurse aide should have their feet separated in the standing position to: Option A, provide a wide base of support. Option B, to prevent straining the knees. Option C, relieve the pressure on the toes. Option D, distribute body weight evenly.
The correct answer is option A. Provide a wide base of support. Provide a wide base of support. When feet are placed shoulder width apart, a comfortable and wide base of support is established. With a wide base, you are less likely to lose your balance.
Question 85. A nurse aide is assigned to a stroke patient with a diagnosis of aphasia. Option A, the nurse aide knows that the resident cannot walk. Option B, the resident cannot swallow. Option C, the resident cannot talk. Option D, none of the above are true.
The correct answer is option C. The resident cannot talk. The resident cannot talk. When a client has suffered a stroke or other head injury, the speech center of the brain can be damaged, resulting in aphasia. Chief signs are difficulty finding appropriate words when speaking, trouble understanding speech, and difficulty with reading and writing.